So good morning, everyone. This is Julie. I am one of the health education specialists here at CRIHB. We have some important dates because we have some funding announcements that are going to be sent out on August 3rd. So our first, and this is for the ACORNS as well as the CITE, the California Indian Tobacco Education. So the first due date is August 3rd. Our RFP is going to be released. And then we are going to have some due dates in between, some webinar dates. So all of our grantees, you guys can call in, or potential grantees can call in, and we for Q&A sessions, and then as well as we're going to have the opportunity where you can send in your pre-application. Our ACORNS team will review the application. We will provide you with feedback, and then you could resubmit that final application. Okay, so I'll give you some dates right now. So August 8th, August 15th, August 22nd, and it's August 29th are going to be our Q&A sessions where you can call in, ask us any questions you want, and we'll give you feedback. We are going to be taking your pre-applications in all the way up until August 27th, and then we're going to review those and we will provide you with feedback, okay? So then your final applications are going to be due September 4th by, I think, isn't it by midnight? So September 4th by midnight. But something that's really important, so August 27th, that is the last date that we will take pre-applications and provide you with feedback. Please give us a few days, you know, to get your responses back to you and your feedback back to you. And remember, September 4th, your application is due. So now I'm going to turn it over to Monica, and she's going to introduce our presenters.
Yeah, good morning, everyone. Thank you for joining us. We are happy to be with the American Indian Cancer Foundation again. Who's going to provide us with a fantastic presentation today. We have Amanda and Donis, and I'll let them take over.
Thank you, Monica. Again, my name is Donis Chosa. I'm enrolled in the Boys Fort Band of Ojibwe, which is located in northern Minnesota, but originally from a small tribe called CRIHB Indian Community, which is located in the Upper Peninsula of Michigan. I'm the Prevention and Policy Specialist here at the American Indian Cancer Foundation, and I've been here over 4 years now, and happy to be in partnership with CRIHB.
Hello, everyone. My name is Amanda Dion. I am an enrolled member of the Northern Cheyenne Tribe and also from the Turtle Mountain Band of Chippewa Indians, and I am a Prevention and Policy Coordinator at the American Indian Cancer Foundation and have been here for about 4 years. And today we will be giving a presentation about policy implementation in tribal communities. By the end of the webinar, participants will be able to understand the need for comprehensive tribal health and wellness policies and effective implementation strategies, provide examples of health and wellness policies in American Indian communities, and access and share health and wellness policy resources. We're starting off this presentation as we commonly do with data. This is because those of us working in public health, as well as many other sectors, need good data when we consider policy initiatives within American Indian and Alaska Native communities. This image was taken from our American Indian Alaska Native Cancer Burden booklet that is available online or via mailing. AICAF created this booklet from the disparities in cancer mortality and incidence among American Indians and Alaska Natives in the United States, published by the American Journal of Public Health. One major takeaway is that the chart on the right depicting that for American Indians and Alaska Native cancer death and mortality rates have increased over the past 20 years while decreasing for whites over the same time period. Another takeaway is that it was found many cancer mortality and incident rates American Indians and Alaska Natives face are tied to health behaviors. The information to the left is an image taken from our Cancer Burden booklet highlighting specific cancer data from the Pacific Coast region. Although the Pacific Coast region has fewer cancer disparities than other regions, they are still worse rates there are still worse rates for some of the top cancers compared to whites. So as you can see from this chart, cancer diagnosis for women in the Pacific Coast is breast, lung cancer, and cancer death. Highest cancer death rates are for lung, breast, and colorectal. For men, common cancer diagnoses are prostate, lung, and colorectal, and cancer death is lung, colorectal, and prostate. All of these cancers, aside from prostate, are preventable cancers in some respect and are heavily tied to health behaviors, which are things like smoking, as well as obesity and diets. Some of them are tied to genetics, but primarily being related to health behaviors. When working on health and wellness policy initiatives in American Indian and Alaska Native communities, it is important to understand the role government policies and systems have played throughout our history. Due to the fact the United States imposed policies on tribal nations that were intentionally created to have had a long-lasting negative impact on our culture, families, and communities, the results from those impacts are seen and felt in the health and economic disparities that we face today. This list is just some of those systems and policies that were put in place. The first one, the Indian Removal Act, was to grant unsettled lands in exchange for Indian land. The Dawes Act reduced the tribe's ability to live in their traditional ways and ended communal ownership of land and parceled it up into pieces to be owned by individual Native Americans, which impacted the tribe's ability to hunt and live off of resources they previously lived off of. The Indian Reorganization Act was intended to end the Dawes Act and the government program that individualized and privatized American Indian lands, which was never an American Indian value. This made it possible. This made possible the organization of tribal governments and tribal corporations. Some other ones are the Indigenous Freedom Act, the Commod Food System, boarding schools, and Kill the Indian and Save the Man. We like to reflect on these policies and systems that were imposed on American Indians and relate them to some of the health impacts and health outcomes that American Indians face today. A lot of these policies and systems imposed historical trauma on our communities, as well as restricted our access to health and wellness. So as the Allotment Act was saying, it restricted our access to do traditional hunting and gathering. And then the Commod Food System came, which gave us food that had no nutritional value, as well as high in sugar, salts, and fats, which caused a lot of chronic disease burden within American Indian communities. So when we think of health behaviors within American Indian and Alaska Native communities, we need to keep them in the context of trauma, both historical and current. Stresses, which include racism, poverty, and other systemic inequities, cultural separation, historical genocide and assimilation, which is the extermination and repression of American Indian culture, and living with the oppressor. Unlike other marginalized communities, American Indians and Alaska Natives still remain on the land base and are regulated and influenced in many ways by the federal government for the past 500 years. Along with keeping those government policies and systems and impacts in mind, at the same token, we need to keep in mind that even though we often hear that trauma is woven into our DNA, we must not forget that resiliency and strength are too. This quote was taken from one of Donis's friends, and it's just important to reflect on that even though, you know, we carry historical trauma inside our DNA and it plays a role in our health and wellness, that we also carry resiliency as well. Next, we'll go into talking about some of the factors that influences an individual and community's health, and those are defined as social determinants of health. They include things such as transportation, access to safe physical activity sources, access to healthy foods, access to affordable housing, and access to high quality education. This 40% was taken out of the Minnesota Department of Health Advancing Health Equity report that was published in, I believe, 2015. And based off of some of the research that they have done, that the state of Minnesota Department of Health has done, they came to the conclusion that 40% of the individual's health is comprised of societal factors such as these, and play a huge influence on the health and well-being. From that same report, they came to the conclusion that 30% of an individual's health is caused or influenced by health behaviors. So whether or not somebody is a smoker or is not a smoker, or uses harmful tobacco, exposure to secondhand smoke, access to screening or having low screening rates within communities, alcohol use and abuse, lack of regular physical activity, as well as diets that are high in animal fats and lower in fiber, with a lack of fresh fruit and vegetables. With that being said, tribal sovereignty is definitely an asset that American Indian communities have to influence those two areas of health and well-being that make up an individual and community's health. And so the definition of tribal sovereignty are federally recognized tribes are recognized as possessing certain inherent rights of self-government and are entitled to receive certain federal benefits, services, and protections because of their special relationship with the United States. And it is time to utilize tribal sovereignty to advance health equity in tribal communities. So basically saying that as sovereign nations, tribes have the ability to administer and regulate health and wellness policies to really promote and advance health equity and improve health outcomes within their community. Health and wellness policy is a upstream approach for cancer prevention. And so we'll get into more specific examples of what health and wellness policies can look like in the workplace and in tribal communities that will start to change health outcomes and normalizing health and wellness within tribal communities. But we just wanted to acknowledge that it is an upstream approach in really trying to prevent chronic disease through normalizing health and wellness behaviors before it's seen in chronic disease rates within communities. This is a chart taken from that Advancing Health Equity report produced by the Minnesota Department of Health. And it just is a further depiction of what makes up an individual's health. So as you can see, the 40% is on social and economic factors, 30% are health behaviors, 10% is clinical care, 10% is physical environment, and 10% is genes and biology. And policy change has the ability to affect positive change in social and economic factors, therefore making impact on health behaviors by normalizing health and wellness. Elevating health policy can be achieved by organizing, leadership, and community buy-in and support, by having a clear vision and strategic plan to get you to the end goal, increase community capacity to come together to reach the desired change, as well as having the data to make the case of why the change is needed. This graphic just shows the relationship on how health and wellness policy can impact a community's health outcomes, because policy has the ability to cause a decrease in excess morbidity and mortality related to preventable chronic disease among American Indians. Because an increase in health and wellness policies has an increase in access to health and wellness opportunity, and with those increased opportunities, there is an increase in health behavior change. So more community members or individuals within the community space have access to something as simple as healthy vending machine options and having water as an option always starts to change different behavior so that it's not always an unhealthy choice that's chosen each time, which increases in normalizing health and wellness within a community. This is taken from a research study done by the Robert Wood Johnson Foundation, and it is a life expectancy map within the Minneapolis and St. Paul area. So this is a 3-mile stretch in Minneapolis and St. Paul, and within these 3 miles, there is a 13-year lifespan difference. We wanted to include this information to show that there is data to support that if there is access to healthy opportunities such as transportation, safe physical activity spaces, and healthy foods, that you see that in life expectancy of individuals. And so in Minneapolis and St. Paul, the areas where people have a higher life expectancy have greater access to health and wellness opportunities, and those that do not have 13 years of a shorter life expectancy.
So as Amanda was saying, we're able to increase life expectancy in our communities by applying effective sustainable strategies such as PSE changes. This slide here gives a brief definition of mainstream PSE versus PSE through an Indigenous lens. This is just more of an overview of the first presentation in the series that we had with grantees in late May. So it just has the definition of PSE change, which is a framework for making changes at the policy, systems, and/or environmental level to create a broader sustainable impact in advancing health and achieving health equity. And I'll just read through the first example, a policy approach. The public health definition is changes in rules that encourage or discourage a certain behavior. But when we're working with our communities, we can look at that, consider that through an Indigenous lens, which would be looking at policy as guiding principles for ways of living, respect for our elders, never taking more than we need, and then also showing appreciation and respect for all living things. So before we get into policy, we want to provide a brief understanding of tribal law. Keeping in mind that tribal laws are not the same for all tribes, neither is the process for implementing certain laws, resolutions, ordinances, policies, etc., especially compared to the federal, state, and local governments. Each tribe is an individual nation, keeping in mind that there's well over 500 of them, as we talked about earlier, and each have the right to govern themselves. And this is what we also mean when we talk about sovereignty as well, that we have the right to govern ourselves. So this is just a list of different language tribes may use. Resolutions, which are usually a statement of intention or support, while ordinances or code sections create something that is more enforceable. Sometimes resolutions are used to pass codes or ordinances, but to be sure of the differences between the two, check in and ask your tribal attorney, because these definitions, again, vary from tribe to tribe. Or you can also seek a copy of a resolution or ordinance to determine how they are commonly laid out in your community. Ordinances versus codes, just using the phrase code or code sections provides stronger implications of sovereignty versus just using the word ordinance, which is most commonly used when talking about local governments. Tribal governments also have agencies or departments that issue regulations to implement these laws. This slide came from the Public Health Law Center, who we partner with from time to time. We also have developed a resource of PSE change strategies and their impact specific to our communities, American Indian, Alaska Native communities. This provides a model that can be used in your communities and tailored for your needs. An example would be a PSE strategy. The policy strategy would be limit distribution of sugar sweetened beverages at tribally sponsored community events and gatherings. So the policy impact would be decreases in excess morbidity and mortality related to obesity and diet related illness among American Indians. And this is just an example that we use and tailor to our communities. So I believe some of you have seen this before, but for the school, the common approach would be teach a unit on risk factors for smoking, but a policy approach would be implementing and enforcing no smoking policies for faculty and students during school hours and on school grounds. And then for the work setting, the common approach would be offer chronic disease prevention trainings for employees once a year, but the policy approach could be implement a comprehensive employee wellness initiative that encourages physical activity throughout the workday. So tobacco policy. There are many tobacco policy strategies that can be implemented in our communities. They can range from basic tobacco policies that prohibit the use of commercial tobacco at workplaces and within 50 feet of entrances and windows, and on or near playgrounds and other areas where children gather, to more complex strategies like refusing to accept tobacco sponsorships, bans on tobacco advertising and promotion in the retail environment, and then also increasing the price of purchase age of tobacco to prevent youth initiation. It's important to always include the promotion of traditional and sacred tobacco use when you're creating a tobacco policy, especially if we want them tailored to our communities. So why enact a tobacco policy? Because tobacco policies protect non-smokers from secondhand smoke, motivate commercial tobacco users to quit, reduces smoking prevalence among workers and the general population, prevents early initiation among youth, and then for most American Indian communities, lung cancer is a leading cause of death. So by enacting tobacco policies, that could lessen that cancer burden. So when workplace healthy food policy, so when developing a workplace healthy food policy, it's important to make sure to identify the policy to implement based on the input and interest from leadership and colleagues, and then also sharing sample policies with your work partners and colleagues. Some examples for a workplace healthy food policy could be healthy food options at community events, providing healthy food at meetings and work events, providing water or low-calorie beverages at meetings or events, and using local or native grown or native made products. And actually, I kind of want to talk about this food here. In partnership with Well for Culture, you may have heard of them. They're I guess like a indigenous physical fitness, indigenous food, I don't know, duo that goes into different tribal communities and teaches them the importance of like healthy living. And they came and hosted an event for us, which was a really great turnout. And they made sure that we provided a healthy meal for the community that we were working with. And this was the outcome. And our caterer was able to work with us to create a very healthy indigenous meal, which was very exciting. And it looks good too. So why enact a workplace healthy food policy? Employees often eat one or more meals at work. It provides easy access to healthy foods at work and encourages healthy eating. Developing policies for healthy meetings and events makes healthy choices more widely available and also normalizes healthy eating where we live, work, and play, which is important. So healthy and indigenous vending policy. With a healthy and indigenous vending policy, you can require healthy indigenous foods in vending machines. Choosing the right healthy vending standards is important. An example here would be USDA's Smart Snacks, all food sold in school standards. And you can find that PDF at fns.usda.gov. Decide on percentage of healthy indigenous foods to include in the vending machine. Working with vending representatives, they're usually knowledgeable and very accommodating to your needs and wants for a healthy vending machine. And then use pricing and placement to promote healthy indigenous options, and then also providing calorie information on packaging. Why a healthy and indigenous vending policy? because they're convenient, common source of snacks and beverages, often only contain unhealthy options. Policy can expand access to healthier food and drinks. These images here are an example of a tribal community that we worked with to implement a healthy indigenous vending policy. In the first picture in the top left, you can see that only pop is available. But after the policy was implemented, you can see that there are many more options, including waters, fruit juices, and teas. And this community chose to go with a 75% healthy and indigenous vending policy, as well as making sure that the placement and pricing was used to promote the more healthy options, so that you are able to actually physically see the healthier options at eye level, along with the marketing that they have down below. You can actually see a bottle of water there versus a bottle of pop. Workplace active living initiatives. So these are some examples of what you can include in a workplace active living policy. Paid staff time for employees to be physically active during the workday, allowing and promoting walking meetings, investing in office furniture that promotes movement, such as standing desks, workplaces, treadmills, yoga mats, light weights, etc. Incentivizing employees who participate in employee active living initiatives, through paid time off, raffles, gifts, prizes, etc. Requiring physical activity breaks for longer meetings and events, and offering health insurance plans that incentivize health and wellness. So this is an example of a tribal employee wellness policy from a tribe in South Dakota that allows their full-time employees 180 minutes per week to participate in wellness activities such as physical fitness, health promotion, disease prevention events, nutrition education, behavioral health, self-help sessions, tobacco cessation, preventative health screenings, safety awareness and education, personal empowerment training, and wellness conferences, along with other anything else that has to do with employee wellness. So why active living policies in the workplace? One of the largest benefits we see to active living policies in the workplace is that employees are typically busy. We find that a lot of people just really don't have the time to be active. So having an active living policy removes this time barrier for employees. Also having an active living policy can also be used as a recruitment and retention tool to attract and retain high quality employees. Tobacco, healthy eating and physical activity policies in the workplace will help create a healthier work environment and culture that can result in increased work productivity, leads to fewer sick days, reduces healthcare costs, as well as a supportive environment to adopt a more healthier lifestyle for the employee and their family outside of the workplace. In this photo here, you can see one of our meetings where we opted to serve fresh fruits and vegetables rather than unhealthy snacks. Challenges and barriers. So it's important to anticipate early on what your challenges and barriers are going to be when creating policy initiatives, so that you're able to develop strategies to minimize the impact or avoid them altogether. So this is just a list of challenges and barriers that we tend to encounter the most. So gaining leadership and community buy-in is always a factor to consider when developing and implementing policy. Policy wouldn't be successful without the backing from leadership and community. So some of the possible strategies to gain leadership and community buy-in on policy initiatives can be to host stakeholder listening sessions to listen to potential feedback or concerns, provide resources and plan gatherings that educate on the benefits of potential health policy changes, and then offer incentives to motivate community members. Attitudes and beliefs also must be taken into account. Determining how you will navigate the tribal political arena when developing and implementing policies is also important. perceptions of the views of others also may have an impact on the success of your policy initiative. Others may not believe that recommendations reflect the evidence or that the changes will result in better health outcomes. So it's important to find solutions to change those negative perceptions that some may hold. It's important to think about how you will realistically enforce your policy. Policies are only successful if they are properly enforced, and we'll cover that more, policy enforcement more later in this presentation, but just keeping in mind how you will inform community members of a policy as well as compliance and regulation if necessary. It's important to ensure that your organizational structure is conducive to change, determining what system changes need to be made to ensure success, answering the following questions: do you have the right resources available? Will you need additional personnel support? Is your policy sustainable? That'll turn it back over to Amanda.
Now we will look closer to tribal health and wellness policy initiatives that we have worked on in partnership with some of our tribal partners here in Minnesota. First, I'll start by defining what health in all policies is, which is an approach to tribal policies that weighs the potential health impacts of decisions seeking to avoid harmful health impacts and improve community health outcomes. Health in all policies is an approach that we advocate for and are in support of here at the American Indian Cancer Foundation. We are also aware that applying a health in all policies approach to tribal government systems is not always what's right for all tribal communities. But the reason why we support this approach so much is because because this approach takes into consideration health impacts of policies across the board. So bringing it out of a tribal health and wellness department and bringing it to economic departments or employee departments and making sure health impacts for community as well as tribal staff are taken into account on all levels. And that goes into and can be tied back to leveraging tribal sovereignty, since tribal governments are self-regulated and self-determined, that these types of approaches can be implemented within American Indian and Alaska Native communities. Now I will share specifics to our health and wellness policy here at the American Indian Cancer Foundation. So part of our policy includes choosing indigenous and local foods as a first food choice when serving food for events and meetings. Following the recommendation portion sizes according to current nutritional guidelines. And so when we are ordering food for staff and or participants, ensuring that when we're working with our vendor, that there's a clear understanding that what we serve is going to be in proportion to what those standards are. Choosing healthy over less healthy choices. So when we are working with vendors and suppliers, really talking through menu choices, and if they don't have options available that are healthy, asking them for alternatives or asking if they can change one type of food for something that may be healthier. So if you're, need to choose a chicken, making sure that the chicken is grilled instead of fried. And if the vendor doesn't offer grilled, seeing if that would be a possibility. Avoiding sugar sweetened beverages, and then disallowing employee reimbursements for the purchase of sugar sweetened beverages. This is a video that was produced by Blue Cross Blue Shield of Minnesota, which was a funding partner of the American Indian Cancer Foundation. They still are. They fund some of our Healthy Native Foods work here at AICAF, and they wanted to highlight our foods policy and wanted to share.
To me, a healthy community is one where we all have access to healthier food options in all walks of life. Native Americans were once like the healthiest people. Now we're seeing higher rates in diabetes, obesity, all these risk factors for cancer. The American Indian Cancer Foundation has implemented a healthy eating policy where we have healthy foods at all of our events, even in our staff meetings. Food is something that's very important to the American Indian people. When we get together, food is always present. I think people really need to be aware of what they're putting into their bodies. Food should be something that gives you energy. It makes you feel good. Our mission is to reduce cancer, and we know that healthy eating can reduce your cancer risk. If we want to share that healthy eating is important, we need to really be able to model this behavior and walk our talk. My hope is that our healthy eating policy will continue to grow and evolve, and that other organizations will join us by implementing a healthy eating policy of their own. I'm Neely Snyder, and I believe a healthy community is a strong community.
So yeah, that video just highlighted why we at AICAF are so passionate about healthy foods policy and our vision for and hope for other communities. This is a resolution from the Lower Sioux Indian community honoring Little Crow with Healthy and Indigenous Foods Initiative. We've been working with this community for 4 years now and helped with the development and establishment of a Health and Human Services Advisory Committee. And early on in conversations with that committee, access to healthy foods was a priority that came out over and over and over again. And so through working with that committee, after some time, they implemented the honoring Little Crow with Healthy and Indigenous Foods, which was signed by their tribal council. And so this is some components of that resolution. They did a vending machine standards, vending machine standard component. So they opted for 75% of their vending machine choices to be healthy and indigenous. They use pricing and placement to promote healthy options, as well as providing calorie information for all food options. The policy resolution calls and encourages Powell vendors to provide healthy and indigenous foods and a 50% discount on vendor fees. And so if a food supplier offers 100% healthy options, which they did come up with a guideline for enforcement, they can receive 50% discount vendor fees for selling food at their powwows. With that piece of the policy resolution, they did have many stakeholder conversations with their powwow committee to ensure that they're not implementing a policy that is going to be in conflict with that committee. And so doing the groundwork, which we'll cover a little bit later on in this presentation, and making sure that you're having those conversations with your stakeholders is so important to any policy initiative. And then it called on the committee to develop a strategic plan and recommendation for other food outlets. Within that healthy foods resolution, there was a call for a departmental healthy foods policy. So creating standards and guidelines for employees who are purchasing food for meetings, gatherings, and events within that community that are funded through tribal dollars. And so A, B, C, and D just outline some of what the policy entails. I won't go into it too much because we are coming up on to 2 p.m., which is when this presentation is going to end. So if you want more information or want to know more about any of these policies that we worked on in partnership with tribal communities, they can be found here within the presentation, and/or you're always welcome to contact us and see and for more information. And so the healthy foods policy, the committee spent a lot of time on what the enforcement would look like for this policy and came up with some language on how employees are to follow it. This is part of all tribal employees handbook, and so it will follow progressive action as any policy would within that handbook. But there's also acknowledgement that in order for it to be successful, it needs community buy-in and support, just like anywhere else. And so this is a picture that was sent to us not too long ago of the food that was served at a tribal council meeting. And so tribal council is taking the policy very seriously, which is great to see. And now instead of having cookies at their, frequent meetings, they're having fruits. And so from now, as that community moves forward, having healthy foods at their employee and tribal council meetings is going to be what's normal for that community, which is awesome. This depicts a comprehensive tobacco policy that we at the American Indian Cancer Foundation worked in partnership with the Prairie Island Indian community. Their policy is called Prairie Island Indian Community Healthier Environments Tobacco Policy, promoting traditional use of sacred tobacco and protecting community members from commercial tobacco harms. Here are a few points of what that policy entails, and some of those examples that Donna shared earlier. We try to carry them forth in the policies that we work on in partnership with tribal communities. And so we have recommendations here at AICAF, and it's up to the community and the tribal partner that we're working with to say, yes, that will work for our community, and we will, we want to go with the recommendations, or well, maybe 50 feet is too much for our community. We should do 25 feet. And here at AICAF, we are open to whatever the community is ready for. Here is a timeline of the process that it took for policy implementation within that community. So they've requested assistance from AICAF. We are a technical service provider to some tribal communities here within our state through our statewide health improvement state dollars. And so once they reached out to us for technical assistance, we contacted our public health law center partner who provides legal expertise. So whatever policies that we work on, and with tribal partners, we ensure that they are legally sound by working with our public health law center partner. Then we held a series of calls with Prairie Island staff, AICAF, and the Public Health Law Center when drafting the policy, to make sure that what we were hearing from them was what the policy had covered. And then AICAF drafted the policy, the Public Health Law Center provided feedback, Prairie Island provided feedback and edits, their SHIP coordinators, and then AICAF, Prairie Island, and Prairie Island staff presented the policy draft to their tribal council. The tribal council and legal department finalized and adopted the policy, and then the policy implementation and signage took place within that community. These are some enforcement strategies that were identified and implemented within that community to help with the success of the policy. And here there's also a recognition that the policy is only going to be successful if the community as a whole acknowledges it and supports it. These are some of the background kind of activities that the SHIP coordinators did when thinking about enforcing this new tobacco policy. And so on the upper right, you can see some tobacco signage that was made. And then and then to the left and bottom are GIS maps of what that smoke-free ground buffer area will look like for their community buildings. And so they provided this to their tribal council, as well as I think they have it available so that people and community members and staff know what it looks like and how far they have to go out in order to adhere to their policy. This is a GIS map just showing where they're going to hang those tobacco signs. And now we'll go into some health and wellness policy resources that we have developed here at the American Indian Cancer Foundation.
Thanks, Amanda. So there's 5 steps to developing effective policies, and we'll get into more detail in the next slides coming up, but just listing them all. The first is gathering buy-in and input from stakeholders, research, policy creation, policy presentation and approval from leadership, and then policy actualizing. So gathering feedback and concerns from those who will be affected by policy change should be included in focused conversations, listening sessions, and formal and informal discussions. This feedback can be obtained from community members, tribal members, leadership, and even as specific as youth, elders, and parents. Research, providing information that shows a community's current reality is important when developing policy. Helping determine best starting points, providing justification for policy change, and identifying best practices, which include collecting the relevant data to include in policy to help make that case for change to leadership. Researching if the tribe or your organization has a related existing policy that you can kind of get an idea of that from. Research policy examples from other tribes or organizations. And then determining if your tribe or organization requires a resolution or policy or both to make changes, and we talked about that earlier, and maybe that includes having a talk with your tribal attorney to determine that. Policy creation, creating a draft policy using feedback provided by stakeholders or coalition members is important. Utilizing technical assistance providers such as AICAF or expert partners. Identifying a clear policy purpose is also very important. Using accurate health and revenue data to make that case for change, including why and how the policy will help improve the health outcomes for your communities. Also determining the best way to enforce policy, and then tailoring those enforcement strategies specific to your community just to ensure that they're effective and realistic. And then sharing drafts with expert partners, technical assistance providers, and or tribal legal departments to get feedback and edits until fully satisfied with your policy. So remember when drafting a policy to be clear and specific, be concise, consistent, practical. Make sure you do your research, identify deal breakers early on, tailor policies to your community, and then draft ideas with coalition and or stakeholders, just to recap. Policy presenting and approval. Present policy draft to leadership. It's important to utilize community champions and or coalition, as Amanda talked about earlier, to help present policy initiatives, which is something that we do, and Amanda kind of gave examples of that previously. Leadership definitely enjoys hearing from their constituents when enacting a policy. In advance, be sure to prepare for any questions or feedback that your leadership or council may have. They may have changes that they would like to see in the policy prior to approval, so determining those parts of the policy in advance that you would be willing to make compromise or make changes to is important to identify early on. If the leadership does not approve the policy, don't get discouraged and don't give up. Policy change doesn't happen overnight. So in planning to develop a policy or policy actualizing, it's best to start with a strategic plan, which could include developing a long-term goal, objectives, and a timeline, organizing, identifying priorities for yourself, leadership, stakeholders, and your community, engaging stakeholders that support policy. It's important to brainstorm ideas with stakeholders to inform that strategic plan. Seek funding if necessary to support policy. Determine where that funding is currently available and where it's lacking. Determine the best way to inform stakeholders and community members of the new policy. An example of that could be tribal newsletters, through email, through memos, presentations, providing signage, could be posted via social media, websites, booths, community events, etc. So evaluation is a key component of any project. Evaluation is the process of gathering data, analyzing and utilizing it to determine the effectiveness of policy change. It can be used to set baselines, identify where the biggest need is, demonstrate the need for funding, to inform an action plan, and can also be used to review progress of the plan, and if the goals and objectives have been met, and if not, can help you determine how to revise a plan to meet those goals and objectives. So for any policy to be successful, there needs to be an enforcement strategy planned ahead of time so that people can stick to the policy and take the policy seriously. These are some strategies to enforce policies for employees, a program or department, for vendors and suppliers, and then educational institutions and retail businesses. I'll just do the first one due to time. For employees, you could create an enforcement strategy would be to create and require yearly training on policy and how staff adhere to policies. Again, we'll be providing you with a PDF version of this presentation as well, so you can go back and look through some of the different enforcement strategies that can be used. So these are some of the policy resources developed by AICAF. They're online, or else you can reach out to us and we can definitely get those to you. We'll provide you with our contact information on the last slide. This one is just a 5-step guide for health and wellness policy implementation. We gave a brief example early on in the presentation as well of this one. And then this one is just a healthy and indigenous foods guideline checklist for tribally sponsored meetings, gatherings, and events. This is another one that we kind of briefly went over, policy, PSC change strategies and impacts. And then our Healthy Native Foods Toolkit, which I know this one for sure is available online. You can find it at AmericanIndianCancer.org, along with a ton of other resources that we have tailored to American Indian Alaska Native communities. We also have some webinars up that you can use if you go to acaf.org as well. And this is our Sacred Traditional Tobacco for Healthy Native Communities infographic, which identifies a variety of policy systems and environmental change strategies in an American Indian Alaska Native community. And we have several of those. We have one geared towards healthy eating for strong Native communities as well. We have a few minutes. Is there any questions?
Do we have any questions for Adonis and Amanda?
I have a question for you. So in one of your slides, the challenges and barriers, or well, no, that wasn't it. The Government Policies Indian Removal Act, you had a picture on there. Where did you get that picture?
Oh, I think
Yes, that, yes.
That picture, I'm not exactly sure where it was pulled from, but it's a depiction. I think it was the MHA Nation had to sign a government policy which released a lot of its tribal land base to the U.S.
Oh, okay.
And so as you can see, that's their tribal chairperson, and he was visibly upset about.
Yeah.
Yes, yes. Okay. Did you have another question?
I think that was it.
Okay. First, we want to say thank you to both of you again for such a very informative and in-depth presentation. All the material that you offer today is so very helpful. I wanted to, and you probably did mention this, but along with the toolkits that are online, the guide and the checklist, those are accessible on your website as well too?
Those we have not published externally yet, but we do have those available, and they're going through the last round of finalization now. And so if you're interested in seeing those, definitely reach out to us and we can, we'll share those. I think we're going to share them to a broader audience.
Okay.
Nice.
Okay, perfect. And then you also mentioned about that you offer TA assistance on policy development. Is there a fee for that? Would they go to your website or call you? What if they were interested? What would they do? And then if there was a cost, what would that be?
So a lot of our technical assistance will be tailored to whatever the community wants or needs from us, and then it would have to go through our prevention and policy manager, and then she would kind of work out what that would look like with that partner. And if it is covered under the scope of our work with current funding, then we definitely could provide that assistance through AICAF. But if it doesn't fall under the scope of the work or what we have dollars available for now, then we would just have to work that out.
Okay. And would it be best for them to contact you via email, phone, if they were interested?
Yep. Email and phone. And so you can use either of the email addresses that you see here, or give us a call, and then we'll connect you with our manager, as well as have those more discovery conversations of what exactly the needs are.
Okay, great. Sounds good. All right, thank you. Does anyone else have any other questions? Okay, well, I want to say thank you again. Before we conclude, I'm going to hand it back over to Julie, and we'll go from there. Thank you, guys.
Thank you. Those slides were fabulous, and we're going to probably even pick some of those slides out of yours for the information. They were excellent.
Yes.
So for some of you that came on later, I've seen a few of you came on later, I want to share some of our dates. So we have RFPs that are going to be released for our ACORNS and our CITE, which is our California Indian Tobacco Education. Those are going to be released on August 3rd. We are going to provide numerous webinars for Q&A sessions to happen. So that's going to be August 8th, August 15th, 22nd, and the 29th. You will also be able to submit a pre-application for us to review and provide you with feedback. We will accept those all the way up till August 27th. So if you get them done early, you can submit them at any point, but August 27th is going to be the final date that we will review those and give you feedback. The final application is going to be due on September 4th. And also, before you guys leave, we have some poll questions for you. If you can complete the poll and submit before you log off. All right, guys. Thank you, ladies, once again. It was great.
Thank you so much.
Yeah,
fantastic.
Thank you. I do have a question. I was wondering, would we be able to see the recorded or get our hands on the recorded copies of the presentations, and then also the poll results, if possible?
Yes. Yes.
Awesome.
Yes.
Cool.
Yes. So we're gonna launch it now. Okay.
Sorry. That's okay.
You wanted the results or the questions?
Oh no, the results. I don't know. The results, I think, have the questions if they send.
Yeah, and then Monica can share those with you, even the past presentations.
Yes.
Okay, awesome, cool.
In the past posts. Yes.
Awesome.
Yes.
Good.
Thank you.
Thank you guys so much. This was so helpful. Very.
I'm glad.
Thank you. Have a good.
All right. Take care.
Bye.
Bye.
So where do you see how many people have completed?
Right here.
There's only one person still on.
No.
Julie,
Yes, my dear.
I did the poll and it won't let me submit. It keeps coming up with an error.
Uh-oh.
Yeah.
Well, you know what, darling?